Your nails are trying to warn you, and most people over 60 are ignoring the message completely. Doctors call it a silent signal, a tiny billboard sitting right at the end of your fingers, broadcasting information about what's happening deep inside your organs, your blood, and even your nervous system. And here's the unsettling part. By the time most people notice something is off about their nails, the underlying condition has often been quietly developing for months, sometimes years. If you're over 60 or you love someone who is, what I'm about to walk you through could genuinely change the trajectory of your health. Because there are specific nail changes, four in particular, that neurologists and internal medicine specialists say should never be brushed off as just getting old. Let's be honest about something first. When you hit your 60s, you get used to your body changing. Your knees creak a little more. Your energy dips a little earlier in the day. So when your nails start looking different, thicker, more brittle, a strange color, it's incredibly easy to file it under normal aging and move on with your day. That reaction is completely understandable. Nobody wants to become the person who panics over every little bodily change. But that very mindset, that reasonable human tendency to normalize small changes, is exactly what allows serious conditions to go undetected for far too long. Your nails are made of a protein called keratin, but underneath that keratin is a rich network of blood vessels, oxygen supply, and nerve endings, which means your nails are essentially a live feed of your circulatory and metabolic health. When something changes internally, your nails often show it before you feel it anywhere else. Now, here's where it gets interesting. And stick with me because the fourth sign on this list is the one specialists say is the most overlooked, and it's connected to a disease almost nobody suspects from looking at their hands. But we'll get there. Let's start building the picture from the beginning. The first major warning sign is a change in nail shape known as clubbing. This is where the tips of your fingers become rounder and more bulbous, and the nail itself starts to curve downward over that rounded tip, almost like an upside down spoon. It can develop slowly, so slowly that people genuinely don't notice it happening to their own hands. A simple way specialists check for this is called the Shamroth window test. You place two fingernails together from opposite hands, nail to nail. Normally, this creates a small diamond shaped gap of light between them. If that gap disappears completely, that's a red flag. Clubbing is strongly associated with chronic low oxygen levels in the blood, and it's frequently linked to lung disease and heart conditions, including congestive heart failure. Your heart and lungs work as a team to get oxygen into your bloodstream. And when that system starts to struggle, your fingertips are often among the first places the body reroutes and restructures blood flow. This is why cardiologists and pulmonologists specifically ask patients to show their hands during checkups. It's not a courtesy, it's clinical. Now consider the second sign, and this one is deeply tied to something incredibly common, especially in older adults, particularly women. It's called koilonychia, but you don't need to remember that word. What you need to remember is the shape. Instead of your nails curving outward like a healthy dome, they start to scoop inward, becoming concave, almost like a tiny spoon that could hold a drop of water. This spooning effect is one of the clearest external signs of significant iron deficiency anemia. And here's the part that catches people off guard. Anemia in older adults doesn't always show up as the classic symptoms you'd expect. Yes, fatigue is common, but many people over 60 just assume they're tired because they're older, because they slept badly, because life is demanding. They don't connect the dots to their blood iron levels. Meanwhile, untreated anemia can quietly strain the heart since the heart has to work harder to pump oxygen-poor blood throughout the body. In some cases, chronic anemia in older adults has been linked to underlying issues like slow internal bleeding, malabsorption problems, or dietary insufficiencies that have built up over years. That spoon shape isn't cosmetic. It's your body flagging a resource shortage. But that's only half the story because the third sign is one that catches people specifically because it seems so harmless at first glance. Yellowing of the nails. Most people's first thought when they see yellow nails is nail polish stains, or maybe a fungal infection. And sometimes that's exactly what it is. Fungal infections are common and usually not dangerous. But when multiple nails, not just one or two, become thickened, yellowed, and the growth rate noticeably slows down, specialists start considering something called yellow nail syndrome, and its connections run deeper than most people expect. This pattern has been associated with chronic respiratory conditions, and notably with thyroid dysfunction. Your thyroid is a small gland in your neck, but it regulates metabolism throughout your entire body, including how quickly your cells and, yes, your nails regenerate. An underactive thyroid, something extremely common in adults over 60 and frequently underdiagnosed because its symptoms mimic normal aging, can cause nails to grow slower, become brittle, and take on that dull yellowish tint. Fatigue, weight changes, feeling cold all the time, thinning hair. Sound familiar? These are symptoms people often attribute to simply slowing down with age, but your thyroid doesn't slow down because you're aging. It slows down because something is actually wrong with the gland itself, and your nails may be the clue that gets you to ask for that simple blood test. Now, here's a moment I want you to really sit with, because we are approaching the fourth sign, and this is the one that specialists say gets missed more than any other, precisely because it doesn't look dramatic at all. In fact, it looks almost the opposite of alarming. It looks calm. It looks pale. Before we get there, let's talk about why this matters so much specifically after age 60. Your body's ability to compensate for internal problems decreases with age. In your 30s or 40s, your organs have more reserve capacity, more ability to mask a developing issue and keep functioning normally on the surface. But past 60, that buffer shrinks. Small dysfunctions surface faster and more visibly, and nails, because they grow continuously and reflect months of internal activity in their structure, become one of the most honest, least biased indicators available. This is precisely why so many physicians, and yes, neurologists specifically, examine hands and nails as part of a broader neurological and vascular assessment. Nerve health and circulation are deeply intertwined, and peripheral areas like fingertips are often where circulatory problems make their first appearance, long before someone feels numbness, tingling, or pain. So let's talk about that fourth sign now. It's called Terry's nails, and here's what makes it unique. Instead of a color change like yellowing or a shape change like clubbing or spooning, this presents as the majority of the nail turning a pale, almost white or ground glass color, while only a thin strip near the tip retains a normal pinkish-brown band. It can look almost aesthetically neutral, even clean, which is exactly why people don't flag it as a problem. But Terry's nails have been closely associated with several serious systemic conditions. Liver disease, including cirrhosis, is one of the most well-documented associations because liver dysfunction affects protein levels and blood vessel patterns beneath the nail bed. Congestive heart failure is another. Tying back to that same oxygen and circulation theme we discussed earlier, kidney disease has also been linked to this pattern, since the kidneys play a critical role in filtering the blood and regulating the body's chemical balance. And significantly, diabetes has been associated with this nail presentation as well, particularly in long-standing or poorly controlled cases where changes in small blood vessels throughout the body, including those feeding the nail bed, become measurably impaired. So there you have it. Four distinct nail presentations: clubbing linked to heart and lung function, spooning linked to iron deficiency and anemia, yellowing linked to thyroid dysfunction and chronic respiratory issues, and Terry's nails linked to liver, kidney, heart, and diabetic complications. Four completely different conditions, and yet all four are potentially visible right now at the end of your own fingers. Here's where I want to validate something because I know exactly what might be going through your mind right now. You might be looking down at your hands mid-video, wondering if your nails look normal, and suddenly every ridge and pale patch feels suspicious. That reaction is completely natural, and honestly, it's a healthy one, as long as it leads you to calm, informed action rather than panic. Nail changes are not a diagnosis, they're a prompt. A prompt to get actual blood work done, to have an actual physical exam, to ask your doctor a direct, specific question instead of waiting for your next scheduled checkup 6 months from now. Doctors consistently say that patients who bring up small physical observations like nail changes often end up catching underlying conditions earlier than those who wait for more obvious symptoms to appear. Early detection genuinely does change outcomes, particularly with thyroid disorders, anemia, and early kidney or liver dysfunction, all of which are far more manageable when caught before symptoms become severe. Now, here's the part that ties everything together, the piece I promised you at the start, the number one insight that specialists want people over 60 specifically to understand. It's not really about memorizing four separate nail patterns. It's about adopting a completely different relationship with your own body. Most people only look closely at their body when something already hurts. But by the time pain shows up, many of these underlying conditions have already been progressing quietly for a long time. The real solution, the one insight that matters more than any single nail sign, is building a habit of proactive monthly self observation. Once a month, take 30 seconds. Look at your nails in good lighting. Compare them to a photo you took the previous month. Check the shape, the color, the texture, the growth rate. This single habit costs you nothing, takes almost no time, and yet it transforms you from someone reacting to illness into someone catching it early, on your own terms, using information your body was giving you the entire time. Because that's really the core insight here. Your body doesn't hide these things maliciously. It's not trying to trick you or catch you off guard. It's constantly communicating, constantly sending small, honest signals. The problem has never really been a lack of information. It's been a lack of attention. And the moment you start paying attention, really paying attention to these small physical signs, you shift the entire balance of power back into your own hands, quite literally. So if you found this valuable, and I genuinely believe it could help you or someone you love catch something important early, do two things right now. Hit subscribe because we break down exactly this kind of overlooked, potentially life-saving health information every single week. And hit like on this video so more people over 60 actually see it before it's too late for them to act on it. Your nails have been talking. Today, for the first time, you actually understood what they were saying.